my presentation over Foley catheter protocol. All right, introduction is catheter-associated urinary tract infections. We'll be going over the problem, literature review, PICO question, theoretical framework, design, setting, and sample, and data collection analysis. I believe that catheter-associated urinary tract infections are becoming more common and can create even more health problems for patients. I have witnessed many patients on the unit who have had Foley catheters who have developed catheter-associated urinary tract infections when it could be completely prevented. The problem is catheter-associated urinary tract infections. According to the CDC, a catheter-associated urinary tract infection occurs when bacteria pass through the urinary catheter and causes an infection in the urinary tract. Zermley 2018 recognizes that catheter-associated urinary tract infections are considered the second most common infection within healthcare. Patient outcomes are increased hospital costs, mortality, and lengthier stays. There are 5 literature reviews I'll be going over. The first one is a nurse-driven protocol. The setting was in a Midwestern hospital in the United States. There were 115 patients, and the intervention was a nurse-driven protocol. It included educating nurses on proper care of Foley catheters, when to remove a catheter in a timely manner, how to assess the catheter after removal, and ways to decrease the total number of catheter insertions. The instrument used for data collection was a 10-item questionnaire that was given to staff at the end. Significant findings was a decrease in catheter-associated urinary tract infections, and the level of significance at the beginning was 0.05, and the NP value was less than 0.03. Recommendations for this literature review were to increase the group size and expand the time frame. A quality improvement initiative. The setting took place in a Philadelphia Children's Hospital. It did include 44 patients around the age of 18 years old. The intervention was a prevention bundle that included training on how to properly insert a Foley catheter, ways to maintain a clean catheter, and how to assess a urinary catheter during each shift. The instrument used for data collection was documentation on the patient's chart, and the significant findings was a decrease in catheter-associated urinary tract infections. The level of significance was set at 0.05 in the beginning, and at the end, the p-value was less than 0.02. Recommendations for this was to increase the sample size. Next one is the prevention bundle. The setting took place in a Danbury hospital in Connecticut. It included 310 patients who were over the age of 18. The intervention was the prevention bundle, and it included education on how to clean properly with cleaning wipes, confirming the level of the drainage bag was below the patient's bladder, verifying the tubing did not have any kinks, ensuring the bag was not touching the floor, and discussing with the physician when to take out the Foley catheter. The instrument used for collection was the census log of the patients. Significant findings was a 50% reduction of catheter-associated urinary tract infections. And the recommendations were to increase the number of patients so it could be generalized to a larger population. Comprehensive unit-based safety program. This took place in an urban hospital in the Midwest and included 902 patients, and the intervention was a unit-based safety program. This included educating on nurses how to insert a Foley catheter, proper catheter care, appropriate documentation, and correct position of the Foley bag, and when to remove the catheter. There were also reminders placed throughout the unit that included ways to clean the Foley and how to take it out. Instrument used was the documentation of the nurses. Significant findings was a p-value of 0.001. And the recommendations were to observe a larger unit to increase the overall sample size. And the last one was an indwelling catheter protocol. It took place at a St. Francis hospital located in Connecticut. It had 2,469 patients. The intervention was a catheter protocol. It included education on placement, maintenance, and care for the urinary catheter, assessment of the catheter site, when to remove the catheter, and how to scan the patient's bladder. Instrument used for data collection was the American College of Surgeons National Surgical Quality Improvement Programs. The significant findings at the beginning, the p-value was set at less than 0.05, and there was a significant result after the implementation, with the p-value being 0.028. Recommendations for this research was to make sure that accurate recordings were being taken by the nurses. My PICO question is, can having a catheter protocol compared to no catheter care protocols decrease the incidence of catheter-associated urinary tract infections in catheterized patients? Theoretical framework. The model that I chose was Newman's systems model. It included primary, secondary, and tertiary preventions. 6 steps of the Newman systems model was assessment of the patient, making a diagnosis based off of data collected, setting goals, creating a plan, applying the primary, secondary, and tertiary nursing preventions, and determining if balance was restored for the patient. The design would be quantitative because the data collected from the patient's chart would be turned into numerical data. It would include a retrospective chart review and independent t-test. It would be used to compare having the protocol and not having the protocol. And it would include patients 3 months prior to the implementation of the protocol and 3 months post. An experimental group would be used because patients would be chosen at complete random. The setting would be a medical surgical unit in the United States. It would be convenient sampling because the most readily available patients would take part in the data collection. The time frame would include 6 months, and there would be 60 patients involved. The sample would be randomization. It would include all age, genders, socioeconomic classes, and all marital statuses. The sample would include any patient who had a Foley catheter. Consent would not be needed because it would be a retrospective chart review, and rights and confidentiality would be maintained by not including the patient's name or any information on the data collected. Data collection would be a quantitative, objective measurement, and this would include nursing documentation. The nursing documentation of the prevention bundle and each patient's Foley catheter within the medical surgical unit's urinary catheter assessment section. The data analysis would be an independent t-test. It would compare patients 3 months before and 3 months after the prevention bundle, and it would be used because the same patients would not be compared to each other. And conclusion. Catheter-associated urinary tract infections have become a major problem throughout the United States. This research could improve patient outcomes by determining if Foley catheter insertion is appropriate and when a catheter should be removed to ensure patient wellness. Further research should be studied to provide awareness of the problem and determine additional interventions that could lower the rate of catheter-associated urinary tract infections. This is my reference page. Does anybody have any questions?
Nope.